My name is Rodney Purvis. I have been here with the organization for 12 years. I have adopted and fostered quite a few pets. Jacob came into the shelter about 3 weeks ago. With most French bulldogs, there's generally medical issues that come with them, especially as they start getting older. So he has some skin issues, eye issues, of course, breathing issues. So all of these things are being addressed currently by the vet.
So we looked at Jacob today. He's in for his 2-week checkup. He was diagnosed when he came into the shelter with chronic dry eye and chronic allergic skin disease and obstructive airway disease, which is very common in Frenchies. So he's been on a lot of different medications. Today his eyes are looking much better. They're much less inflamed. He will be on medication for life to help keep his eyes moist because he doesn't produce tears anymore. We're going to have to find a maintenance program to keep his skin from getting worse, but it's doing a lot better. And then his airway disease we're going to address a little bit later once he's in a little better shape.
So as a staff member, one of the things that we do on occasion is foster a dog or a cat that's in need. Dogs like this overheat very easily, which you can't really keep in a shelter environment. So whenever there's a case like this, it's better to put them into a foster home. So currently I'm fostering him while he's going through all the medical treatments. One of the good things about fostering is it's very rewarding. It's nice to be able to see the beginning and the end of the journey for one of the pets.
We met Frosty about 2 months ago. He came to us from a rescue. And they weren't able to take care of him medically. He had a fracture in the humerus and a healing fracture in the femur. He also had a laceration, like a wound in the tail, and the way it was healing, it was cutting off his circulation in the tail. So for his quality of life and for a better adoption candidate, we decided to proceed with surgery. For his fractures, it's strictly cage rest, nothing, no jumping, no playing around. He just rests in a cage and slowly the fractures are healing really well. So eventually he's gonna be a normal kitten and able to run and jump around.
Frosty, he was a little teeny cat, very cute, very affectionate, but he was on bed rest. And so he stayed in the cage all the time. And he didn't seem to mind it.
The foster loved this cat because he is the sweetest cat. He's really snuggly and he's really playful and he just wants to be a kitten, and unfortunately he has to be staying in his cage. He needs to be calm, no jumping around, and it's a kitten. That's what he wants to do. So it has been hard for the kitten and the foster to keep him confined and help him heal with cage rest.
So we got my friend here, Jacob. Let's do an examination on Jacob. And I can see in the back of my friend Jacob's skull, he's got an elongated, soft palate. And we can hear little Jacob's breathing is very, very loud. And when I put pressure on his windpipe, you can actually hear him snore a little bit more. Jacob is a candidate for having the BOAS surgery. This is a minimally invasive procedure in which we can remove that excess tissue, and then removing that will cause him to breathe a lot better. Some of these animals spend the rest of their life breathing through a cocktail straw. That's not fair to the pet. This is one procedure in which we will see results the day of his procedure.
So one of the things at Pet Alliance that we have are very skilled veterinarians. So they are able to do surgeries that I wouldn't necessarily expect all shelters would be able to do. So with that, we get to be able to help a lot of pets that have medical conditions that maybe other shelters wouldn't be able to help. We also have our own clinics, which also helps because with those clinics, we can also take some of our shelter pets and then they can do some of those surgeries in the clinics as well. So our veterinarians are able to do some amazing things with the equipment that we currently have. Imagine what they could do with things that we don't have. We're really able to go a step further and help a pet that may not have gotten the help that it needed. We have really been focusing on trying to improve their quality of life, and the equipment that we need is just one step towards that.
His amputation surgery was apparently very smooth. He came right home and adjusted perfectly and continued being a sweet, snuggly cat. He's got one more week of bed rest, and I really look forward to him finding his forever home, and they're going to have a wonderful time.
So here at Pet Alliance, we see a lot of cats like Frosty where they come wounded from outside the streets or people that are not able to care for them. So rescue contact us and we're able to help them and give them a better quality of life, give them the medical attention they need. And once they're all healed up and taken care of, they can find their forever homes and never have to suffer that way again.
So Jacob has been doing really well since he's been home. He's been recovering well. We took him the other evening to the park and he walked around the entire lake without the whole panting thing that he normally does so excessively. But I think the thing that's most noticeable is in the evening when he's sleeping, he used to wake up probably 2 or 3 times a night and he'd have to stand up to breathe, and he's not doing that now. So he's actually sleeping throughout the night. So that's been very nice. So since Jacob has been with us, I took him with the understanding that I may keep him. So that was my first thoughts in taking him into the home. I like older pets in general. So I have 2 little dogs at home already and a cat. So we wanted to make sure that he was going to fit into the household. And he does, so we will be keeping him. So it's nice to know that like all of this is being done before I even take him home myself. And we don't do it just for staff, we do it for the general public as well. So anyone who comes and adopt, they're gonna know what the medical is behind each pet that we adopt out. It's really nice when we're able to give that care to each and every animal. So if there's surgeries that need to be done, if there's medications or any of those things that need to be done, it's nice that we have the ability to be able to do that before the pet goes home. So any money that is raised will actually go for the betterment of every single pet that goes out of our shelter.